Hello and good afternoon. My name is Robert Wingo, and I'm here to introduce you to the Centric Scheduling Calculator. I'm a board certified informatics nurse that has 22 years experience in developing innovative solutions in and around nursing budgets and staffing and scheduling operations. According to a 2021 study, staffing shortages have cost hospitals $24 billion during the pandemic. Nurses are leaving the profession in record numbers due to staffing shortages, unsafe patient assignments, and mandatory overtime that leads to burnout, stress, and patient safety issues. And this trend is expected to continue until something is done to improve staffing conditions. News articles have described working in the shortage as overwhelming and like working in a war zone. And one survey reports that 66% of nurses say that the pandemic has made them consider leaving the profession. The CareCentric scheduling calculator provides a solution to creating safe and cost-effective schedules. The CCSC is a business-to-business solution that effectively augments existing scheduling tools and will help healthcare organizations that are overspending on staffing by decreasing understaffing, saving money, increasing revenue, and improving the work-life balance of their staff. Our target customers are hospitals, clinics, and long-term care facilities. Here's a screenshot of our working proof of concept for the CareCentric scheduling calculator that was designed in Microsoft Power Apps. The app provides a common platform for reviewing FTEs, which is preferred by finance, alongside the hours and shifts that are preferred by nursing in order to facilitate discussions regarding resource needs and utilization. The CCSC augments existing staffing and scheduling tools to provide a better understanding of how resource allocation affects staffing capacity. In doing so, it helps facilities to decrease understaffing, overtime cost, and employee burnout. It also helps to identify facilities using a known flawed nursing FTE budget process that increases their risk of understaffing. The problem is that currently available nurse staffing and scheduling systems do not provide the information that the CCSC does. To bring the CCSC to market, we estimate our startup cost to be around $850,000, and these are the identified areas that need funding. We plan to start with a basic app on personal computers and tablets, and we have plans for future advanced functionality, training, education, consulting, and change management support. And it's possible to expand our market beyond healthcare. Here we have the members of our amazing team, myself, Marilyn, Jane, and Efe. With your help, we can bring the CareCentric scheduling calculator to market. We project that we will need assistance with mentoring, funding, technology support, marketing, and sales. And thank you for your time. All right, and so we're looking at the budgeted FTEs for this unit, and this is a pretty large, probably cardiac telemetry unit, 30 patients, average 1 to 3 patient ratio. And so to take care of patients, we need 42.5 FTEs, which is 1,700 hours. That's required by our budget. And then we have a 15% non-productive replacement available, which it turns out to be 7.5 replacement FTEs. So we have 300 hours per week that we can spend on non-patient care activities. So what happens here is this is a perfect scenario. The unit is fully hired, nobody's on leave, nobody's on orientation, and units almost never look like this. So the reality is you're probably going to have a couple of unfilled positions. So we've only got 48 of our 50 filled. You may have a couple of people on leave. And let's say that you've got one of those positions, somebody hired in and is on orientation. Now that orientation person, they're not able to come in and cover for somebody that's on vacation. And so what's happened is that's a pretty common scenario there. And what's happened is your number of replacement shifts that you have available for the week for non-patient care shift has dropped from 25 down to 8. And in that 8 shifts per week, that includes all of your sick calls, all of your time off that you're approving, and also any education time. Because what has happened is you must, and why we call this CareCentric is because we are reserving the patient care FTEs and hours that our budget says is required for patient care. And what happens typically is that nurse managers will overspend on that non-productive time and then put what's left over at the bedside when they create their schedules. And this is how schedules with unfilled shifts get posted alongside an overtime sign-up sheet. And
Hey,
so the
Robert,
info, oh, I'm sorry. I guess I
Got a
believe it was
hands up there.
Annabelle's question about the information that it provides. It provides a breakout of where you're spending your non-productive time, your non-patient care time, and provides you with the calculation of what you actually have left to spend on non-patient care time while leaving enough hours for patient care.
All right, I see Vicky has a hands up there.
Great, thank you so much. A couple comments in the question. Excellent leading off with board certification in nursing informatics. So kudos, I think that goes a long way in a lot of organizations now. So thanks for starting with that. Great, succinct presentation. It was very clear. And yes, well done. This is built in Power Apps. So my question is going to be on the data that you have here. So I think understanding if you're going to be pulling from the Kronos API, for instance, and if you're going to be offering that up as part of your solution, I think that's going to be important. Also going to Anna's point, you had that nice slide talking about the competitors. What I would recommend is having some check boxes, and a grid to show where your competitors don't meet the mark and where you are filling the gaps. So I think showing that clear picture is going to be important because so many organizations already have that scheduling solution in place. But overall, great ideas and well done. Thank you.
Yes, thank you. And as far there actually would not be any interfacing with the staffing and scheduling systems. This is a sort of an adjunct to any system that somebody might have. We're not looking to replace any of those. And this system is actually driven by really more by the financial data. So it would be more of a feed from the institution's position control. And it sort of provides that bridge to facilitate communications between finance and nursing because they can see the FTEs and the hours right there, and they can both talk over that and sort of see how that impacts each side.